Hello, my name is Johnna Charlton, and today I just wanted to talk to you about the SH sound. So, a few things I wanted to cover with you today would be the correct production of this sound, so what it should sound like if we're producing the correct SH sound, the context that this sound is used, where it's going to be found in vocabulary and speech. Also, I want to talk about some of the misarticulations that can occur with this sound and why those things are happening, as well as some strategies for that misarticulation. So, when we're talking about the SH sound, it is closely related to the S sound. However, when you're producing this SH sound, the tongue is a little bit flatter, so it's not as sharp sounding as the S sound. So, when you think about it, that S sound compared to the sh sound, it's just a little bit softer. Also, unlike that S sound, the SH sound is not produced with the tongue directly behind the front top teeth. We call this the alveolar ridge. And so when you're producing that SH sound, it's just slightly more back. So the tongue tip is lifted up and a little bit more back in the mouth on what we would call the post-alveolar area, excuse me, and just like the roof of your mouth. And so to make that SH sound, you'd want to place your tongue on the post-alveolar ridge that I was just talking about, and your lips would be rounded. And so that tongue is on that post-alveolar ridge, a little bit back. The lips are rounded, the tip is up, and the sides of the tongue are a little bit different as well. So the sides of the tongue are going to be rounded upwards and lifted upwards. So I have this little visual here, nothing fancy, but basically if you picture this as your tongue, the sides are just going to come up a little bit like this. Very similar to that S production. Another really cool thing about the SH sound is that it's voiceless. So it being voiceless just means that you're not using your vocal folds or your vocal cords to say the sound. So if you take your hand and place it right on your neck and you say our sh sound, you're going to feel no vibration, or you shouldn't feel any vibration. And when you're making its cognate, or the sound that is, it's the same sound, but it's voiced, it's zh, zh, and you'll feel that vibration. So it's sh, zh, and you should feel a little vibration on your fingers. And that's just telling us that the zh is voiced, whereas the sh is voiceless. As far as its context, the SH sound is not super common in our everyday vocabulary. So we have a scale called the General American English Consonants Frequency Scale. And on that scale, it's just telling us how frequently these sounds occur in everyday vocabulary and conversation. And SH is 20 out of 24, so it's not super high. It can occur at the beginning of the word. We call this the initial position. It can occur at the ends of words, which would be the final position, or in the medial or middle position. So some examples in the initial position would be sharp, the final position would be wash, and so on. It also does appear in some what we call consonant clusters, or in a word, if two or more consonants are in a row, that's considered a cluster. So SH does appear in some consonant clusters, just not very many. And an example would be like shrimp. Shrimp would be an example of that. So let's talk about some of the misarticulations, or the ways that SH can be produced incorrectly and why that's happening. I feel like it's helpful to know not only what the sound is that's being misproduced, but also how it's happening in the mouth that is misproducing it, so then we can work on correcting it. So some of the common substitutions for the SH sound are the S, Z, T, and D sounds. And that's just due to the similar placements in the mouth and the similar ways that the sounds are created. So getting into the nitty-gritty. So some of the misarticulations, one of them would be lateral airflow. So this just means that when you're producing that SH sound, like we said before, instead of having those sides of your tongue lifted up, they're actually going to be pointed downward. So when we're producing our SH sound, we want air to flow through this middle portion of the tongue, like right in the center portion. And that's why our tongue tips are lifted upward. So when we're pointing them downward, the air is flowing through the sides of the tongue. So if that were to happen, it would sound something like so the air is coming through the sides of my mouth, and there's not as much lip rounding that there would be with the correct production. And this is similar to a lateralized S sound, which also has that air coming right out of the sides. Another misarticulation could be the addental, and so that's just when the tongue is too far forward in the mouth. So we were talking about how it's pushed a little bit behind the alveolar ridge or behind the front teeth, and this is just when it would be too close to that alveolar ridge. So the tongue is also less rounded because of this and more flat, so you're not getting that correct airflow, and it would sound something like it's just too far forward to create that. A palatal misarticulation would be if the tongue was too far back in the mouth. So that would be that back portion we call the mediodorsal area of the mouth. So it's making that SH sound kind of sound like a y sound a little bit. So it would be something similar to a kind of sound, something similar to that. And it might sound a little bit like a y, and it's just that tongue is much too far back and needs to be pushed forward. There also could be a nasality to the sound. So if there's ever a nasality in a sound that there's not supposed to be, it's just because there's a opening. So in between the oral cavity and the nasal cavity, there's something called the velopharyngeal port. And this port is what where the airflow comes back and forth between the mouth and the nose, and it closes off for most sounds except for M, N, and ing. And so if this port is open, it's going to give a nasal quality to the sound. So it could sound something like and it would be a little bit more vibrating on your throat. Another misarticulation could be unrounded lips. So the tongue might be in the appropriate position, but there is no lip rounding. So it's going to sound distorted in a little bit of a little way. So instead of it might sound something like a little bit hard to make it without the lip rounding, but it would probably sound a little bit distorted. So now that I've told you all of these misarticulations, I'd like to talk to you about ways that we can correct them. So initially, when I'm working with an individual, I'd want to first make sure that there's no structural or functional impairments that are causing the misarticulation of SH. So just anything besides the misarticulation that could be resulting in that distortion or incorrect production of the sound. So once I've checked that out, and if that's all good, we're going to move on, and I would do some minimal pairs just to determine that the individual understands that SH is its own singular sound. So a minimal pair is when you have two words that are exactly the same, except one sound is different. So for example, with the SH sound, we could have shoe and sue. And so those are slightly different because the SH and the S sound are different, but everything else is the same. And so if you are doing auditory discrimination or showing an individual these two cards and you produce them, shoe and sue, and you say, oh, are these the same or different? And like, do you hear something different? And if they can hear the difference in those two sounds, then they have the sound. So they understand that SH is its own sound, and then we can move on. That would be a whole separate issue if they were not able to differentiate between those two sounds. So, and then lastly, before we get into the methods of correction, I would probably test to see if the alternate production of SH would work better for that individual. So in the alternate production, everything is the same except for the tip of the tongue. Instead of lifting it upwards, you actually just put it right behind your bottom teeth. So it would sound something like, so see, my tongue is right behind my bottom teeth, and then I lift it up and produces sound like normal. So I would try that just to see if that would be a little bit better or worse for that individual. And then once all of that is out of the way, we can get on to the methods. So one of the methods is using the S to SH method. So you can only use this method if the individual already has the S sound. So assuming that they would already have the S sound, all we'd really need to do is add some lip rounding and a slight retraction of the tongue. That seems to happen automatically when you're rounding your lips and producing that sound, and it should produce the SH sound. So they would produce the S sound. They'd be prompted to lip round and retract the tongue if needed, and it would produce the SH. So if you start making the S sound, I can demonstrate it now. So the S, and then I'll do the lip rounding and retraction. It will sound something like this. And you can even have them go back and forth and just feel how they're different. So and you can just hear that difference and feel it in your mouth. Another method would be the T to the SH method. So T and SH are also similar positions. And if that individual does have the T sound, all you would need to prompt is the protrusion of the lips and to really push out that T and retract the tongue slightly again. So it would sound something like you would make that T sound, then they would be prompted to elongate that T sound, push out the T, round the lips. And it makes the SH sound. Another method would be from the CH sound or the ch sound to the SH sound. So they would slowly be prompted to produce the ch sound, and they would be instructed to protrude their lips, and then I would have them lengthen that CH sound, and you would hear that end piece of the SH sound. So it would sound something like ch. And you can hear there the last portion of that sound is the SH sound. If there's a nasality to the sound or any sort of nasal quality, some other methods would be using that T to SH method, as mentioned earlier, because it may avoid the potential nasality of the S sound and the S to SH method. So it would just be the same, protrude the lips, elongate that T sound, and retract the tongue. Another method would be also the method I just mentioned about the CH to the SH method. More forcefully, you would push out that CH sound just to be sure that that port is closing and you're narrowing the airflow through the articulators just to avoid any of that nasal quality in the sound. Also, depending on the problem at hand, vowels are actually really important in the consideration of making the sound because they can set you up for success. So if you're talking about a tongue placement issue, the better, it would be better for us to use the front vowels. So the front vowels are E, I, A, E, and A. And these vowels will help position that SH sound because the tongue is already lifted and moved forward when producing those vowels. So it will be words like she or ship. And then for a lip rounding issue, it would be best to use the high back vowels, some of them such as oo, ah, or o. And those can be used to support lip rounding because they also use lip rounding. So it would be a word like shoe or shoot. So that was really everything I wanted to talk about today about the SH sound. Please, if you had any other questions regarding what we discussed today, don't hesitate to reach out to me, and I would be happy to address any of the remaining concerns that you have. Thank you so much.